Hello guys, today we are going to discuss about a very important antibiotics, that is the chloramphenicol. As we know that chloramphenicol is a broad spectrum antibiotics. It means it kills a wide range of gram-positive and gram-negative bacteria. And we know antibiotics are those substances which obtained from one microorganism and used to kill the another microorganism. That's why it obtained from the microorganism named as Streptomyces venezuelae. Now we are going to discuss about its mechanism of action. As we know that chloramphenicol is a protein synthesis inhibitor. It means it inhibits the synthesis of protein inside the bacterial cell. And we know all protein synthesis inhibitors except aminoglycosides are bacteriostatic. Now we generally look how the chloramphenicol inhibit the protein synthesis inside the bacterial cell wall. Here, this is the chloramphenicol, and we know that this is a mRNA, and this is the ribosomes. Ribosome has two segments, 30S, 50S. This is the bacterial ribosome. Chloramphenicol bind to the 50S ribosomal subunit. Okay, it bind to the 50S ribosomal subunit. By binding to the 50S ribosomal subunit, it prevents the peptide bond formation. Guys, this is two amino acids, and this bond is the peptide bond. This bond is a peptide bond, guys. This bond is the peptide bond, and chloramphenicol inhibit the peptide bond formation. If the peptide bond formation doesn't occur, definitely the protein synthesis not happen. That's why chloramphenicol inhibit the protein synthesis. Now we are going to discuss about the mechanism of resistance, means how bacteria get resistant to the chloramphenicol. Very easy mechanism of resistance, guys. Bacteria produce some enzyme which inactivate the chloramphenicol, means inactivating enzyme production by the bacteria. Along with that, there is a binding site for chloramphenicol on the 50S of the ribosomes. So then bacteria do some mutations in the ribosomal subunit so that the chloramphenicol cannot bind to that particular site, means ribosomal mutation. Third case, it may be possible that, let's suppose this is the bacterial cell, guys, and chloramphenicol has to enter inside the bacterial cell to work properly for the inhibition of the protein synthesis. Bacteria generate a mechanism by which the intake of chloramphenicol get reduced, the decreased uptake inside the cell of bacteria. Now we are going to discuss about the pharmacokinetics. Pharmacokinetics, we have to discuss only two things which are clinically significant. First, pancreatic lipase activate the chloramphenicol in the intestine. Let's suppose this is the intestine, this is the small intestine. Pancreas produce pancreatic lipase, and when the chloramphenicol comes in this region, then it get activated. Let's suppose this is the inactivated chloramphenicol. The chloramphenicol get activated. Along with that, it get metabolized by the glucuronide conjugation in the liver. Liver metabolize the chloramphenicol. There is a clinical significance related to the glucuronide conjugation of the chloramphenicol. Now we are going to discuss about the side effect. There is very important and very easy mnemonic. You can easily remember that his GB, SISGB. This is a very famous mnemonic. You know guys. Now here H stands for the hypersensitivity reactions. Hypersensitivity reactions generally common in approximate all the antibiotics. Then I for the irritative effect, means nausea, vomiting, diarrhea. Now S for the super infections. Why there is super infection takes place? Due to suppression of the gut flora by the chloramphenicol. And G for very important, very famous syndrome, that is the gray baby syndrome. In many examinations it is asked frequently. Gray baby syndrome. What is gray baby syndrome? It occurs in the neonates and premature baby. This side effect is generally dose related, means as we increase the dose of chloramphenicol, the worseness of the disease also increases. It is due to the decreased degradation of drug in the liver. Guys, few seconds ago we discussed about the glucuronide conjugations. If the glucuronide conjugation get decreases, as we know that in newborn this glucuronide conjugation not fully developed. That's why due to decreased degradation of drug in the liver, because the deficiency of glucuronide transferase enzyme which involved in the glucuronide conjugations. If this enzyme get deficient, then chloramphenicol cannot be metabolized properly. It means its level get increases and it's produce toxicity, and and that particular neonates, the skin appear ashen gray color. You know, this is very important term, ashen gray color. Along with that, nausea, vomiting, diarrhea, cyanosis, etc. Such effect has been seen. This syndrome is known as gray baby syndrome. And now B for HISGB, B for bone marrow suppression. You know that bone marrow suppression, it is the most serious side effect of chloramphenicol. And in bone marrow suppression, we generally discuss about the three things. One is anemia, another is another is leukopenia, and next one is thrombocytopenia. Together we all call it pancytopenia. What we call it? pancytopenia. Now we are going to discuss about the last part of the particular discussion. Now uses. There is very important trick about, you can easily remember, ABERT. Guys, you can see here about here A stand for the anaerobic infections. A stand for anaerobic infections. B infections brucellosis and bacterial meningitis. E stand for eye and ear infections. R for the rickettsial infection, and T for the typhoid fever. I hope, guys, you all get familiar about these things, and you'll definitely like this video. So guys, what is your feedback? Please comment on this video. Thank you for watching.